Hello and welcome to this special EULAR preview podcast brought to you by the Immune-Mediated Inflammatory Disease Forum. My name is Xenofon Baraliakos. I'm head of rheumatology at the Rheumatzentrum Ruhrgebiet in Herne and professor of internal medicine and rheumatology at the Ruhr University Bochum in Germany. I am joined today by Johannes Bijlsma, emeritus professor of rheumatology at the University Medical Center Utrecht in the Netherlands, and Professor Laura Coates, NIH Air Research Professor, Nutfield Department of Orthopedics, Rheumatology and Musculoskeletal Sciences at the University of Oxford, UK. In this podcast, we would like to introduce and discuss some of the key abstracts and presentations we've highlighted on our brochures that we are looking forward to the most at this EULAR Congress. The annual EULAR Congress represents an important gathering of people and ideas in the world of rheumatology. With an extensive scientific program covering a wide range of diseases and treatment options delivered through symposia, poster sessions, and presentations, rheumatologists get to engage with the latest data for therapies that impact their clinical practice. The IMID Forum is here to help direct you towards the most valuable content that will help you to stay up to date with clinical practice. As with previous years, we will bring your daily highlight podcast and an overall Congress review to help you get the most out of this year's EULAR Congress. We have identified over 50 abstracts this year, covering key IMID topics. Our highlights are separated into 3 individual preview brochures covering RA, PSA, and axial spondyloarthritis. You can also pick up these highlight brochures at stand S10 at EULAR, or find them on the IMID website, which includes all the session times for the key abstracts we've selected this year. If you would also like to keep up to date with lupus and scleroderma at EULAR 2025, be sure to visit lupusforum.com or sclerodermaforum.com with a minus in between scleroderma and lupus and forum, where you will find a preview brochure featuring the steering committee abstract selections for both these indications. Let's take a look at some of the IMID selections this year, starting with rheumatoid arthritis. Hans, over to you.
Thank you, Xenofon. The first area we will be highlighting is rheumatoid arthritis. The abstract this year focus on both emerging and existing therapies for the clinical management of rheumatoid arthritis. And please take a look at them because they are very interesting. There will be several presentations discussing data on new treatment options at this year's EULARs. For instance, Sarah Baxter will discuss the phase 1 regular RA trial, highlighting the interim safety and tolerability of CAR-T regulatory cells targeting citrullinated proteins in refractory rheumatoid arthritis. In addition, the session Beyond CAR-T cells will see George Schatz discuss T-cell engagers and bispecific antibodies for autoimmune diseases. Then turning to established treatment options. Upadacitinib remains important for rheumatoid arthritis management. Roy Freisman will present a poster detailing 7 years data on the long-term safety and efficacy of upadacitinib compared with adalimumab in rheumatoid arthritis patients from the SELECT COMPARE study. In a separate poster, also very interesting, Gert Boermester will report on the long-term safety profile of upadacitinib across rheumatoid, psoriatic arthritis, and axial spondyloarthritis, based on approximately 17,000 patient years of clinical trial data. Furthermore, part of the clinical poster tour titled News on JAKs in Rheumatoid Arthritis, Cristina Martinez Molina will discuss factors associated with achieving remission or low disease activity in patients with rheumatoid arthritis treated with JAK inhibitors. In the same poster tour, Andrew Uster will present final 2 years outcome from the UPHOLD study that will focus on real-world achievement of treatment targets and sustained response with upadacitinib in patients with moderate to severe rheumatoid arthritis. Then, early intervention and complex case management are 2 critical frontiers in rheumatoid arthritis research, and both are addressed in compelling sessions at this year's meeting. So will Andrew Coop deliver an oral abstract presentation on the ALTO study, meaning arthritis prevention in the preclinical phase of rheumatoid arthritis with abatacept. This long-term outcome study investigated the use of abatacept in individuals at risk of developing rheumatoid arthritis. In parallel, a case-based study led by Ian McInnes focuses on one of the most challenging clinical scenarios, being difficult to treat rheumatoid arthritis. This session highlights the complexities of managing patients who do not respond to standard therapies, exploring emerging strategies and clinical decision-making approaches for this high-needed population. Together, these sessions will provide a valuable look at both ends of the rheumatoid arthritis spectrum, from prevention to advanced disease. Then, moving on to guidelines and recommendations. Every 3 years we have an update, and again Jozef Smoden will present the much anticipated 2025 update for the EULAR recommendations for rheumatoid arthritis management. This update will reflect the latest evidence and highlights what these changes mean for day-to-day clinical decision-making and how they can help personalize care in an increasingly complex treatment landscape. So rheumatoid arthritis research is very much booming, and being up to date for it, visit these sessions at EULAR 2025 in Barcelona. Any comments from my friends on the line? Xenofon, Laura?
Well, Laura, I do have one or two comments. Laura, do you have something to add?
No, I mean, I think it'll be really useful to have the updates for the RA guidance and see how that's bringing all of the data together and what's changed from the last updates. So I think that's going to be the most interesting to look overall at care for patients with RA.
So don't miss this session on Saturday morning.
Well, my comment is in fact actually threefold. First of all, indeed, as you mentioned at the end, Hans, there is still a lot of things going on in rheumatoid arthritis, so it's not over yet, the story, and that's something I think we should appreciate. We're still learning a lot, although we have had so many advances indeed the last decades. There's still a lot of things to learn, and for me, it's extremely important to understand that we are now moving towards not only the update of the treatment strategies, but also the difficult to treat patients, and this is something we now have learned a lot about in the last couple of years. So I'm really looking forward to see what those scenarios will look like, and what we can take from our daily practice, because I think the easy RA, the easy PSA or access spondyloarthritis are easy, but we have still not so few patients who are difficult to treat. So that's for me a very important insight.
Absolutely.
Yeah. And the other thing, of course, we now are in the position of really speaking about thousands of patient years of treatment in different treatments. Yeah, that's something we've never ever dreamt of in the past. So 17,000 patient years is really something, and even in a newer drug, right? That's really something extraordinary, and I'm also looking forward to this kind of data.
Perfect.
All right, thank you very much, Hans. Let's move over to psoriatic arthritis. Laura?
Lovely, yeah. So there's a lot to look forward to in psoriatic arthritis at EULAR. I guess in terms of new drugs that have come or coming through phase 2 trials, we've got some new data around TYK2 inhibitors. So zasocitinib, which was previously known as TAK-279, is an oral and highly selective TYK2 inhibitor where we've seen some data before looking at efficacy compared to placebo in phase 2. But now there's some additional data looking at the achievement of minimal disease activity and response in the skin domain in patients who have active psoriatic arthritis, really as post hoc analysis from that phase 2. And hopefully in the future we'll see further phase 3 data. And then with deucravacitinib, where we've had a little bit more data previously, we've got both of the new phase 3 trials being presented at EULAR. So the Poetic PSA-1 trial will be presented by Desiree van der Heijden. That looks at the efficacy and safety of deucravacitinib up to 16 weeks. And then Poetic PSA-2 looks at efficacy and safety up to 52 weeks in slightly different populations. So that will give us a bit more solid data from a phase 3 trial rather than phase 2, looking at TYK2 inhibitors. In terms of IL-17s, obviously bimekizumab is our new IL-17 on the block, and we've got some additional data now from the 3-year follow-up from the B-Complete study and the open label extension, looking at efficacy and safety over those 3 years in patients who have active PSA and who have failed a TNF inhibitor, which I think is where this drug is being used quite a lot. There's also data from long-term follow-up of the B-Optimal study, which was in the biologic naive patients, so those who had not previously had a TNF inhibitor. And then I'll be presenting some new 2-year data on radiographic progression with bimekizumab from the B-Optimal biologic naive patients and the extension to give us a bit more long-term data on bimekizumab. And then in terms of real world analysis, there's some interesting data coming out of the ProSpirit study, which looked at ixekizumab, but also compared to a number of different biologic and targeted synthetic DMARDs in routine PSA care, which I think adds to the data that we've had from clinical trials and thinks about a more real world and realistic clinic population. IL-23s obviously have had a lot of interest in psoriatic arthritis, and we've got good phase 3 data for these. But there's an additional phase 3 study, APEX, which will be presented by Philip Meese at the conference, and that's looking at 24-week results and investigating whether guselkumab can effectively inhibit structural progression. So in the previous phase 3 trials, the Q8 dose didn't hit significance, so the company have gone on to do an additional phase 3 study specifically looking at radiographic progression with that standard 8-weekly dose. And then complementing that, we've also got some post-hoc analysis of the original phase 3 keepsake trials, looking at the efficacy of risankizumab on different musculoskeletal and patient-reported outcomes. So that's giving us a bit more long-term outcome and multi-domain outcomes of IL-23 inhibition in PSA. And then finally, data around the JAK inhibitors. So obviously, Hans has already mentioned the study looking at pooled data across RA, PSA and axSpA with 17,000 patient years data in safety there, which is really helpful, I think, across different diseases. But also 5-year results from the SELECT PSA-1 study, so the phase 3 upadacitinib data, looking at durable clinical responses and consistent safety profile. Because obviously there has been this question around safety of JAK inhibitors, making sure we get them used in the right patients. And I think particularly in our PSA population, where we do have higher rates of obesity, metabolic syndrome, and other issues, it's something that we want more data on to help us guide the use and the selection of different therapies. So I think that's our highlights for psoriatic arthritis.
Very nice. Thank you very much, Laura. Hans, any comment from your side?
Well, if you're looking a little bit of distance to this area, because it has not been my research area, it's amazing how much progress has been made in the last 10 years. And even now, it's moving very much ahead. So I'm really happy to see all these data. I'm looking forward to visit these sessions at the EULAR Congress.
Yes, indeed. I think they are kind of almost bypassing everything, the people at PSA, isn't it? Which is really interesting. But we learned together, I guess. So seeing what's happening in PSA may impact RA or axial spondyloarthritis treatment. So I think it's really, it depends on where the development is, and that may change again to RA or axial spondyloarthritis. Still, I think it's really useful. Laura, one question: where are the TNF blockers now?
So, I mean, I think TNF blockers are still there. They obviously are still the gold standard and usually the default first line option for biologics in PSA, unless somebody has significant severe skin disease. Because we still haven't had a new drug show superior efficacy to TNF inhibitors for peripheral arthritis. For skin, it's a little bit different, but specifically for arthritis, they're still, I think, probably the first drug that we reach for as a default option. There's some nice data at EULAR looking at early TNF inhibitors and early secukinumab in kind of treatment strategy approaches. So looking in very early patients using biologics initially from diagnosis. And we've shown in a UK study that early use of TNF inhibitors for 6 months improves outcomes at 6 months, but also at 12 months once the drug's been stopped. So I think that's where we move on with TNF inhibitors and think about, particularly now they're much more affordable, can we use them in different ways and think about how we alter our treatment strategy in clinic?
Thanks. I think indeed this is also something that hasn't ended yet, and that early treatment is important and really swapping over to axial spondyloarthritis. So thanks a lot. Indeed, there is a lot to look forward in PSA and certainly also in axial SPA. Therefore, please join me now to take a look at the abstracts that we've picked out for axial spondyloarthritis. Regarding the emerging therapies, which is also something that I believe is very interesting because indeed the field is evolving. We have 2 studies to discuss. They explore the investigational therapies in axial spondyloarthritis with a phase 3 trial presented by Dong Zhu, sharing findings, evaluating the efficacy and safety of xeligekimab in patients with advanced axial spondyloarthritis, the radiographic stage. Separately, from that, Xiaozhong Zhu, who will be presenting a post-hoc analysis of a phase 2/3 study assessing the impact of ivammacitinib on patient-reported outcomes in individuals with active radiographic axial spondyloarthritis, or what we used to call ankylosing spondylitis. These studies contribute indeed to this growing body of evidence that we have potential treatment options that are new in axial spondyloarthritis and go beyond the usual suspects of TNF blockers and IL-17 inhibitors and also maybe JAK inhibitors. Now to the old suspects regarding IL-17A and F. We also here have bimekizumab with a lot of data. They continue building up the story in the axial spondyloarthritis spectrum. We have Lian Gensler, who will report the 3 years findings from 2 phase 3 studies and the open label extensions, obviously, evaluating the long-term efficacy and safety in both stages, radiographic and non-radiographic. Martin Rutweiler from Germany will present the 52-week data comparing 2 remission definitions, the absence of objective signs of inflammation versus the clinically oriented ASDAS inactive disease status definition in patients treated with bimekizumab. And those studies are indeed important in order to understand a little bit better what the contribution and evaluation of the dual inhibition of IL-17A and F in axial spondyloarthritis really means. We also have Victoria Navarro-Compan, who will present 2 analyses from phase 3 trials on ixekizumab, the IL-17A inhibitor, in patients with radiographic axial spondyloarthritis. The one analysis examines baseline characteristics and outcomes stratified by CRP levels that you may also have heard in this forum regarding in the IMID forum regarding the differences or possible differences or similarities between patients with CRP positivity and normal CRP. And the other analysis is a pooled analysis evaluating the efficacy in patients with normal and elevated CRP, again in this whole topic that we've also been discussing in other podcasts. This analysis explored the potential impact of CRP status on the treatment response with IL-17 inhibition, and also will discuss the impact as compared to what we know from TNF blockers. We also have novel mechanistic approaches, so we are focusing on data and research on bispecific T-cell engaging antibodies designed to target TRBV9 positive autoreactive T cells. The story is not very old, but really extremely up to date right now in all discussions in T-cell-driven diseases. This means we are speaking about the T-cell subset implicated in access spondyloarthritis and the impact of treatment there. This work reflects indeed an early stage effort to explore immune cell-directed approaches in the management of access spondyloarthritis. For JAK inhibitors, we remain really positive, and we have more investigations in access spondyloarthritis. I will be presenting data on a post-hoc analysis from the phase 2 Tortuga trial, assessing early improvements in spinal pain and correlations with other clinical outcomes in patients with filgotinib. As Hans and Laura previously mentioned, the poster by Gerd Burmester will provide an overview of long-term safety data on upadacitinib across rheumatoid arthritis, psoriatic arthritis, and axSpA based on the large amount of 17,000 patient years of clinical trial data. There's also some other data on real-world evidence. There's several studies addressing the aspects of access spondyloarthritis management beyond traditional clinical trials. We'll have Diana Maria Margareta Moldovan, who will report findings from an 18-year follow-up study evaluating gender differences in first biologic DMARD use and treatment persistence in spondyloarthritis. And we also have Patrick Pascal-Strunz, who will present a randomized controlled crossover trial investigating axSpA, a digital therapeutic aimed at improving disease activity, functionality, and quality of life. This will be a late breaker. Sophia Ramiro contributes to analysis, one examining secukinumab efficacy in patients below and over 50 years of age, which is the critical age where we know that there might be differences in outcomes in access spondyloarthritis. And another study will be discussing whether imaging or clinical remission should be prioritized in axSpA management, something that I believe is an extremely important clinical question. So these are our highlights for axSpA. I do not know if you want to make a comment on those and if you see any parallels to other directions. Laura or Hans?
I mean, I think the most exciting thing is probably around the TRBV9, isn't it? To think about really changing the paradigm and treating this in a very different way. I guess in the last couple of years, with the inclusion of JAK inhibitors, we've had kind of a whole new mode of action for axSpA. That's been really key, and particularly I think for my patients who have axSpA and inflammatory bowel disease, where we have really limited options. So that's been great, but moving beyond that and thinking about treating things in a really different way is just exciting to see a novel approach.
My comment on that and response to that is yes, absolutely. But we certainly know that the field is even going forward and further than that. So I think this is a very exciting new start.
I have an additional observation that I look at these studies that are now presented today and will be highlighted at EULAR 25, and looking also at other clinical studies and other research reported at the coming EULAR. It's remarkable to note that, of course, there's a lot coming from Europe, but from all continents all over the world, people are bringing the newest data to the most important rheumatology congress in the world, being EULAR. And it's really interesting to see all the data coming from all sides of the world. So an additional argument to come and enjoy EULAR in Barcelona.
That's a great comment, Hans. Indeed, thank you very much for bringing this up. I think this really belongs to all the indications we've discussed today. We see a lot of movement in access spondyloarthritis, but with the contributions of many organizations and many people around the world, also RA and PSA, I believe are similar, and that's important. In fact, this is why we meet at EULAR, isn't it? To really meet our friends from all over the world and discuss their data with our data and network, make friends, but also really exchange interesting scientific ideas.
Absolutely.
All right, I think it's a very good closing statement. We all hope that you've enjoyed this preview. The IMID Forum has plenty more EULAR coverage planned as this congress gets underway. For a condensed overview of the most important abstracts and presentations each day, be sure to look out for our daily highlight videos. After the meeting, we will broadcast our EULAR Congress Review podcast, where I will once again be joined by Laura and Hans. And this will be a great opportunity to listen to our discussions around some chosen abstracts and focusing on the data presented. It's certainly not to be missed, and certainly also we can take up those abstracts we've discussed today and see how much they met our expectations. So don't forget to visit imedforum.com and download our EULAR 2025 preview brochures, which include details on the faculty's top abstracts. And all that remains for me to say that we should enjoy the Congress, enjoy it with us, and see you there.